Okay, so now it's time to talk about how healthcare is delivered and who are the key players, who are the people in our global neighborhood. First, we have transnational organizations like the United Nations programs. World Health Organization is the biggest umbrella organization, but through the UN, we also have UNICEF, United Nations Fund for Population, United Nations Development Program, and World Bank, and all of these agencies work together to promote the Sustainable Development Goals. And that's another part of your content for this week. You're going to look at that website and create a discussion. So, we have bilateral government associations, and these are donor recipient partnerships. They have been criticized for becoming somewhat political. Any given country might only choose to help certain allies in exchange for certain things. USAID, it used to provide aid, and I used to talk a lot about it, but now it's mostly defunct. I think there's still a few administrative workers out there not really doing a whole lot of anything. We have the Peace Corps, that is part of the United States efforts toward global health. They are currently facing deep cuts in an effort to reduce government spending. But other countries have a say in this, so they might have these countries listed here all have official agencies that deal with providing aid for global health. And they are the wealthiest nations in the world: Australia, Canada, Denmark, Finland, France, Germany, Italy, Japan, New Zealand, Sweden, and United Kingdom. And we have non governmental organizations. We have foundations, and these foundations provide grants to other organizations who are implementing programs throughout the world. The most famous of these is probably the Bill and Melinda Gates Foundation, which recently Bill Gates pledged the rest of his fortune to global health in response to some of the cuts that were made to international aid. We have secular private organizations like Oxfam. We have faith-based organizations like Catholic Relief Services. Private organizations like Merck have branches that partner with people in low-resource nations. And then we have contracting agencies, which a lot of times are used by either the government organizations or non-government organizations. Okay. Now, let's talk about some of the drawbacks to this system. NGOs can do a lot of good. They don't have to jump through a lot of administrative hoops necessarily. It depends on how large they are. And they get to determine their own mission and vision. So that's a good aspect of NGOs. However, especially with NGOs that are tied to a particular faith or way of thinking, there have been criticisms that they are attempting neo-colonialism in a global health context. What does that mean? Well, colonialism, of course, is the practice of invading and colonizing another country through military power. What they're talking about here is that we are going back into these countries and we're administering global health in a way that is not culturally appropriate or ethically responsible. For example, let's say that there's a faith-based organization. There's a really good documentary out about White Savior. And this woman goes on a medical mission or a mission overseas, gets inspired, comes back on her own, and opens up her own hospital where she is not a licensed medical professional, but she is performing medical care and she's causing harm. There's kind of a dark side to some of it. It's well-intentioned, but is it really what people need? And why does any graphic of health disparities around the world look like the same map of the colonial territories in the 18 and early 1900s? There's a reason for it. A new way to think about health. Okay. So this is the very lofty, very wordy definition from the World Health Organization. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. Without distinction, you can read the rest. Health of all peoples is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. And I do have an article for you that underscores that. If we want to remain peaceful, prosperous, and safe, it is in our benefit to support global health. The achievement of any state in the promotion and protection of health is of value to all. Unequal development in different countries in the promotion of health and control of diseases, especially communicable disease, is a common danger, and yes, we do need to realize that. In order to effectively create a response to global health dilemmas, we need to start engaging in upstream thinking. So the story goes, there's different versions of it. People are walking along a river, and they notice there's a baby floating in the river. So they all jump in to save the baby. And then there's another baby, and another baby, and another baby, and there's all babies coming down the river, and some of them are drowning, and the people are trying to help, but they can't get to all of them. One of their party goes up ahead to see where these babies are coming from. And it turns out that there is a bridge, and the bridge is broken, and the mothers are walking across with the strollers, and strollers are dropping in, putting the babies in danger. And he says, hey, let's fix the bridge. The real problem is upstream, it's not downstreaming. So if we're always solving problems down here in crisis mode, there will never be enough to really fix it if the real problem is here. Now, you can't leave these babies here, you still have to treat them, but we need to start thinking upstream. Okay, I'm going to break here, and we'll come back and discuss the Sustainable Development Goals as a continuation of this content.